Hi everybody again. We have a lovely lady over here. We're going to do today rejuvenation of a face with fat transfers. As we all know, you may see some markings I already did. Usually I mark half of the face. I want to know where midline is. I saw many times how people do put projected amount of fat they're planning to place in certain areas. I usually don't do that because knowing that our face is not symmetrical, that our muscles do not have the same attachment on both sides of the face, I'm trying to adjust rejuvenation toward this. If we all see what we're going to try to do here, try to replace some youth and the fat to the areas where patient lost it. What happens in the process of aging? Very often we do hear that people say, oh my, when you're getting old, your nose is growing or your ears. Actually, none of this is growing. What happens, collagen quality changes. I'm talking for students, my colleagues all know that. Collagen quality changes, loses elasticity, and then from the triangular face in our youth, we are getting more square face. We do have transposition of fat going in the lower areas, but put all this aside, what is our goal today? Our goal is to bring this back without cutting anything, and I'm going to use 3 sizes of fat. We're going to get back to you when we harvest fat and do everything. I'm just going to tell you that rejuvenation has to start from the hairline. It depends on patient, obviously, situation. We sometimes finish here, sometimes we finish on the bottom of the neck, but sometimes we go very deep to the chest. This lovely lady is very fortunate. Her neck looks fantastic, her chest looks fantastic. We don't have anything to do there, but I'm going to do a little bit of rejuvenation in her hands. She also has very good looking hands, except I see some waste underneath, and I'm going to use the nano fat in the terms of rejuvenation, which is going to be the most active because it's just loaded with exosomes and stem cells. Now I'm going to ask audience, do you have any questions for me before we move patient to operating room about my markings, about anything? I just want to mention one thing. We have to be very, very careful with all areas because we know that face is loaded with the big blood vessels. They're all danger zones, and we have to know where they are and how to avoid them, how to avoid the problem. As we all know, first, do not harm. If anybody has a question, please. If you guys don't have a questions, I'm going to move my patient to the operating room, and we'll talk a little later when we're ready to get back to you. Enjoy your meeting. Thank you. Kao što vidite, pacijentica je spremna. Stavili smo lokalni topical, I'm sorry, I have to switch to English. Sorry, I'm apologizing. We actually put a topical analgesia on patient's face. She's awake, we know that. And it took edge of the pain. I usually do use a little bit of local on a few points in the face to ease the pain a little bit if it's doable, because it's going to be a little uncomfortable for our lovely patient. I did have some questions from audience, and I'll try to answer them right now. If you see our table, you're going to see fat, how we prepared it. As you know, in my tumescent fluid, I told you I did put a lidocaine, which is acid, and in order to preserve fat cells and stem cells we have to wash that fat out. And then I did that with the saline after I finished the harvest. I'm going to address all these areas. I'm sorry, I know it hurts. I'm sorry, I'm apologizing. You're going to like me better when everything is finished, I promise, okay? I used to did all sizes of fat, and I actually realized that best fat which remains is actually with the big particles, and whenever I want to do volumization, I do big particles. I'm going to need 18-gauge needle if you have one, please. 18-gauge, the big one, like with the pink pack. This is my cannula, but I need the cannula too. Can we open an 18-gauge needle, please? 18 gauge, just one. I need some 4x4s.
I think it's the rose.
Yeah. And I'm going to start with actually rejuvenating the forehead. This lovely lady has a little insufficiency in the temporal fossa. We have to be very careful there. We know it's a minefield, and we have to do careful placement over there. I'm sorry if it hurts. May I have 5? Yeah, that 5 millimeter. With bigger cannula. Yep. This is the fat which has the particles about 3. This cannula, please. Yeah. And I'm going to be deep on temporal fascia to place this fat. I'm sorry, a little pressure. Am I hurting you much? I have a best patient ever. She doesn't complain at all. You always have to pull back. Making sure that we are not in any area we don't want to be. And then I put my fat on my way out. This is hard area to address because we are fighting with the tissues which are not very, very expandable. A little pressure over here. Looks better. We have to do a little bit more in the area of eyebrow. I'm sorry, you may feel this. Sorry. Thank you. Okay, and we're going to make little sausagey eyebrows because sausagey eyebrows are youthful eyebrows. We all know that, right? All these youngsters have what we lost. See, beautiful distribution here. Make sure this is all soft. See the difference? Right?
Exactly.
Nice difference, right? Usually I go one side and another. I do not measure how much I put on one side because it is irrelevant since people are not symmetrical. May I have 18 gauge, please? Thank you. Was it horrible? Was it, jel vam bilo bolno puno?
Ne.
Same syringe and same needle. Thank you. I think I did about 2 cc's of this microfat for this region. I think she's gonna need just about the same or a little less. And then I massage it. If someone wants to come out, it's fine. Because really we had a good harvest, right?
Yeah, it was great.
It was a great harvest. Sometimes we struggle, we don't have enough. But patient is really thin, but we got a good harvest over here. And then we're going to distribute this. Sorry I'm pushing on you, but and I'll give you a headache of pushing. Okay. I think she looks pretty much similar. She probably is a little hungry here. We can address it here. Yep. We'll go back and do that. I'm sorry. I'm going to be very careful here. We are not in a blood vessel. Let's do a little bit, and then we massage it. See? Much nicer, right? And we're going to go a little bit there. See if fascia is worth. Make sure it's not danger zone. Massage it. She has, I think, no divots, right?
No.
Looks good, right? Gentle massage. And I'm happy there. Let's work on her cheeks. See, I would love to put a little bit more in her eyebrow to lift it up somehow over here. And you always have to see where your tip is. Now we're talking, right? Look at this now. Better, right? She has a synchrony.
It's even
Nice.
higher.
Right. She's higher here? Okay. Sorry. I got it, right? I think she needs a less here. This side looks better for her. And then for our dictation, I always write how much I put somewhere that I know, you know, I'm happy with this, okay? And if you want to see this, now we actually fill the hollows here. Next area for me to address is going to be her cheeks. I try to be deep under the muscles on periosteum. I'm trying to achieve, can I have 18 gauge needle, please? And I'll try to lift her cheeks to minimize this line here.
You like her to turn the head?
No, I'm okay. I like it actually this way because I can control it. Give me next one, please. Yeah, and leave this aside that we know it was a forehead.
The question was
Ispod fascia.
under the fascia.
Under the fascia. And same deep placement in the cheek. Deeper is better. You have a big fat, and I'm in the right place where I want to be. Some people do this from the mouth. I don't because mouth is not clean, and I am afraid of putting something there I don't want to have. You may feel a little pressure, and I'm sorry about this, but you're gonna love it. Usually I think I did in both supraorbital areas, including eyebrows. I did 4 cc's. And you can see this cheek.
Yes, immediately.
Immediately, instant gratification, right? And then usually I'm very brave in the cheeks because they really have to lift patient's face. And this lady has a fortunate anatomy because she has a strong cheekbones anyways. We obviously have to make sure that patient doesn't look like Maleficent afterwards. We don't want to make it worse. We want to make it better. And then I'm going to do, I usually do cheek and try to kind of be consistent with that.
And the curve and everything.
Yep. And then patient, when she sits up, we're going to see it better, actually. But I usually place it and then sit them up. I'm very deep, but I try to control my stream, and I want to know where did I release it. And trust me, this is no filler, which is going to give you this quick and gratifying result as a fat does. I think we're pretty good there. I think I want to work a little bit on here. First, I'm going to do these areas, and then we'll go further. Okay, may I have a needle, please? See, we can't see it right now because patient is laying down, but when patient sits up, you would see
The jaws are going to be
jaws. Yeah, jaws going to be remodeled, and it's going to be much better, you know. But I usually fill entire triangle. I'll go where she is because it's easier for me to be there. Excuse me, I just want to be where you are. Thank you. You feeling okay? Thank you. Your best patient ever. May I have a fat, please? And this is a 3 millimeter fat, I think. It's macro fat. Everybody noticed that, right? Sorry, a little pressure. I try to get to the angle of the lip over here, right? I have to release it a little bit that I can pull back. Still cannot pull back. Over here, try to be deep around the mouth, if you really go deep, patient's going to be biting her lower lip. Then you not want to be that deep over there. You get this. I'm going to get this side, and I'm going to do chin. May I have a syringe? We did 2.5 cc's over here. See, this is the triangle where you want to fill. But you start from a chin to even it, right?
Okay.
It's not bleeding, it's fine. Ja, izvinite, znam da vas ovo boli. I keep apologizing in our language to this patient because I know she's just very brave, but she feels it.
And this region is usually more sensitive.
Yeah, this region is very sensitive and it has like burning sensations and stuff. We did marionette lines here, and I would love to have some more for chin, please. How nice, right?
It looks great from above.
Looks great, but we have to actually do a little bit over here as well because she doesn't want to have these indents. She doesn't want to. This is a ligament there which is holding it. We're going to camouflage it a little bit. Thank you so much. I'm going to do her chin. Try to use the same opening. This will be the, or not. Can I have a needle, please? Okay. And I'm sorry. And I know this is also deep, but if I don't address her chin, she's not going to be happy, lady, because we have to balance it. The most important thing is that you are placing fat on your way out, not on your way in. This is a little safety measure which can prevent us to do stupid thing.
That's great. Only the mental crease, maybe?
Crease will be a good idea. Yep. May I have a...
Yes.
Okay, let me just see, can I come from here? I hate to open for her a million holes. Just gonna address, I'm sorry, I know, I'm sorry. Pull it back on your way out, push it in. Good, okay. She has this
It's
much
immediately
softer
better,
now,
yeah,
right?
softer.
And then when we address her lips, it's gonna be even better. May I have a needle?
Yes.
I'm just gonna go sides now.
Would you like her to turn the head?
It's okay because I see indent
Okay.
here. I'm sorry, I know it's gonna be a little uncomfortable for you. Okay, see how I broke it? And now we're gonna make it a little bit softer. Don't do that because if you're pulling it, you're losing orientation. See?
Just want to be useful for you.
Yeah, I know. You are very useful. You did all this with me. You helped me all. See, I'm going to inject a little soft to cover this. And this side, it doesn't have this problem. You see that? It's much different. Izvinite, ovo ću vas malo boliti prsti. Vi ste najhrabrija žena koju ja znam, gospođo. Okay. And I'm going to feather it a little bit here to cover this angle. And Omar, just massage it. Okay. Don't cover her head. Okay. Now, now this looks good. We're going to camouflage it a little bit with a nano here too, but we still can massage it. Push it. I definitely have to undress her nasolabial folds. And how much of it we used? I think I did the 2.5, 2.5, 5, 10, 5 and 5, 2.5, 2.5.
24.
This is my 6th syringe.
Yes, it is.
Okay, very good. We can only imagine how this is going to be much cheaper than if somebody is doing filler because we know that hyaluronic acid is very expensive, comes in syringe, gives us a little bit and sometimes gives us trouble. I'm not saying this cannot give you trouble, but that's why we have to be really careful. We have to go with all techniques and safety measures that we know how to protect our patient. And this is a ticket, right? Yeah, I'm sorry. Izvinite, znam da vas malo boli. See? Beautiful, right? Okay. My needle, please. We're almost done, okay? Izvinite. Okay. Can we lift the table now a little, her back actually, that she sits up a little bit? We're almost done. A little bit fat around your eyes and stamping, and that's it. Okay, just want to make sure. Okay. Omar, if you want to come here to see, when we add the gravity to her, how this face looks. Right? She looks symmetrical. Now I want to do around her eyes a little bit, but I'm going to do smaller fat there.
For the crossfit.
Crossfit actually, and I want to feel a little bit here under the, yeah, this fat is, I'm going to use this one, just a smaller, this, and I'm want, because outer, can I have a needle? What I usually do on outer part of orbital wall over here, I'm going to do a little bit bigger particles and much smaller ups over here. But in order to do this, I think I'm a little vertically challenged. And we can get table a little bit down. And then we're going to sit patient for you afterwards again. I'm happy with this. It's nice and subtle. And patients don't want to look like somebody else. They want to look like themselves. Just a little younger, right? At least that's what I want. Sorry. I'm on the orbit here, very deep, and I feel tip of my cannula. We pull it back, and I leave few drops on my way out, and I feel those drops under my finger. Okay, nice. Nice. This is a smaller cannula. See how it's nice now, right? And then we're going to come with the nano fat. You just go on your side to finish other side. Yep. And I have a needle, please. We're almost done. Sorry about this. It's so good. This is the last painful thing, I believe. And obviously, I thought that my cannula is clogged, but no, it's not. It's good, okay? See, what I love to do, she has a little bit over here of indent, see? And I would love to give her drop. And I'll try to get it from opening I have here. It's already closed, which means this lovely lady has a good clotting factors. May I have a needle, please? It's already cold. You look great, really. I really like it. Thank you. Jeste. Ja nikad ne radim, I'm not doing overcorrection ever because I'm not that brave. I correct as much as I think it's necessary. Definitely it's going to be some absorption. In my hands, I believe that I have very good acceptance of a fat. Usually at least 50% of my fat stays, but I'm brave to say sometimes it's 75% because touch-ups in my patients I don't need to do, and I have long-standing cases about 10 years. touch-up is usually if they need it like 5 years later because process of aging is continuous. But absorption is going to happen. See, she doesn't have the DVT.
Yeah.
Yep. Okay. We can lay patient now flat because I want to do inside. Can I have a nanofat, please? Going to inject medially with nanofat because I would love to be very gentle there. And this lovely lady did have eyelids done in the past, and we don't want to ruin any of that. Thank you so much. You'll need, I just need my small cannula. You just gave it to you. Thank you. And we're going to do stamping, and technically it's done. Well, obviously we all know that fillers are lasting up to 18 months, the thickest ones. And can you close your eye, please? And they do have, it depends how much somebody needs. Would I really tell somebody who's like in their 20s or 30s jump on a fat grafting for 3 or 10 cc's or 5 cc's for that matter to do fat? Absolutely not. But if somebody needs rejuvenation, which is a little bit more serious, then we really have to reach to fat. I think my cannula is occluded. Can I have another cannula, please? What?
Or maybe it's because of the
Yeah, it's closed. And then we have to, for people in middle-aged ladies, I think the best filler is their fat because it lasts longer. It's much cheaper. I can harvest as much as I want and do whatever I want. When I'm doing filler, which patient pays, which is a pricey, then I have to do as many cc's as a patient is willing to pay for. And then, but it's a lot of benefits in doing fat grafting because this fat is really is going to become yours, most of it. And I think we did well here, right? Mm-hmm. And then it's going to get revascularized. And you also have benefits of having the stem cells and exosomes and human growth hormone, which is, yes, may I have a needle back, please? Doing this, you have, I would say, much more benefits. But it's not that everybody is candidate, and it's not for everybody. And we have to be smart who this is good for. I hope I answered the question. Any other questions? Do we have any more questions?
We are waiting.
Okay, good, good, good. Thank you, thank you, thank you. See how beautiful this looks. It's nice, it's not heavy. And
it won't have the water retraction after all.
And actually, very good point Omar is saying, we do not have actually absorption of water in a fat. Very often, we have a problem with the hyaluronic acid that I'm going to need little local to give her dental blocks because I don't want to make her struggle when I'm doing her lips. I'm sorry. Just going to give you dental blocks that your lips don't hurt when I do it, okay? Thank you so much. Daću vam dentalni blok, izvinite, samo malo jer neće vas ništa boliti onda. I to će proći za sat vremena. Okay. See, this lady has really beautiful lips. They're very full, and I'm sure when she was a few years younger, they were much fuller. And then this will be like not good to change the shape or anything. I'm going to do just a little because I would love to really fill her lip a little bit here, not to make her lippy-looking lady. She doesn't need that, and she wouldn't like it, but to just restore a bit of her anatomy, which she lost from before. Je li vam ovo nama ovdje? Jeste li utrnuti malo ovdje? Je li vam utrnula usna? Okay. Jeste li u redu?
Jesam.
Hvala. I need the bigger fat now. Okay. Give me a smaller one, but wash one previous one, wash it and open it. Još malo pa smo završili. Okay. And also, why people do hate to see lips which were injected, because injectors are not following anatomical structure of the lip. Technically, when we're trying to replace something, we have to know how these lips actually become lips. Plastic surgeon with a long training, we know how we have a fusion over here. If a fusion doesn't happen, if buds didn't fuse, we have a cleft. So when people try to fill a lip, they have to really stick to anatomical pads, which were there when we were developing, right? But a lot of people make just one big lip, which looks like a sausage, and it doesn't look aesthetically pleasing. And then we get criticized, and these women get criticized. But as we know, we are responsible for this. Samo ću ja malo, gospođo. And my cannula seems
Maybe it's
tiny. Can I have a little bigger cannula now?
maybe it's occluded.
Yeah, I'm just going to do a little bit to give her balance. Look how beautiful everything looks now. She's going to have little fullness here. Nemojte se, ja vam, gospođo, neću napraviti neke velike usne, da znate. I to što ćete vidjeti immediately, to će biti swelling. And I tell my patients, they're usually scared to look crazy or augmented and stuff. And I always tell them, you're going to be a little swollen and just a little bit, see? Just to stretch it a little bit. And we have to obey these anatomical, we have to respect anatomy. May I have, nešto od ovoga je tečnost koja će se apsorbirati, znate. And obviously some of it in the lips is liquid which is going to get absorbed. Needle. Okay, thank you very much for your questions and watching and everything. We're going to get back with the pictures when we're finished. We're almost done. Just a little stamping on the face. And if you have any questions on the stamping, I'll be back to you guys very soon. We can talk. Okay? Thank you, everybody.
Ti radi u drugoj sali, i onda su se uključivali.
Samo da znate, usne vam sad izgledaju velike, to će biti sve manje, da znate, to se sve resorbira, nema oteklina, nemojte se bojati. Te se žena reći, Bože, što mi žena nagradila, jel?
Ali nije.
Idemo mi klip 3, mi snimamo na kraju, bit će na YouTube-u i ko bude htio može pogledati sve do
Bravo.
Mahira neki priča, sve će čuti.
Bravo, odlično. I sada završavam, zašto stavljam u vermilion nanofat?
Idemo, snimamo.
Zato što ima jako puno lines pacijentica i želimo te lines obogatiti i stimulirati smanjenje dubine lines, jel? Ovdje imamo samo ovaj enčas. Mogu dobiti iglu, molim vas? Ovakve je gospođa imala usne kad je imala 20 godina. Vjeruj mi. Pogledaj sad bud and bud and bud and bud. Nećeš joj napraviti tire. Viš kako ljudi stave isto oko. Respect anatomy, and we have to know how everything, embryology.
Yes.
Embryology is a very important part. If you don't know how lips got developed, I don't think you should ever inject the lips.
Yes, definitely.
Right? Because you don't want to make somebody look crazy and miserable. You want to make them look good. Okay? And now, if you don't mind to give me needle, I just want to give her nanofat here because this is actually attachment of the ligament here for mentalis. And then it's not going to be easily broken. I'm sorry about this. But she actually has a block now. She's not going to be hurting.
This region, I think it's not.
Yeah, it's not that sensitive. But I really want to pump it with this. Izlazi van? Ne izlazi. Dobre. It's okay. See? How nice. Sada ćemo uzeti jedan stamper ti, jedan ja. And as a finalization, I'm going to do micro stamp. She looks beautiful. I love lips. Look.
Yes. They look
This is
really
beautiful,
nice.
huh? Vidite,
And
imali
from
ste...
this view,
It's beautiful, and I love it. No. I need the stamps now.
And I have the opportunity to look from the above and everything.
It's really amazing, right?
Yes.
You're going to do one side, and I'm going to do other side over here. But I love to do, yes, please. We're going to take a top off. And it's going to look like it's not coming, but actually it does. Možda je malo ovo neugodno, izvinite. Jel vas boli ovo, gospođo? You can come very close to her eyes because this is really opportunity. I'm sorry. Relax. Sorry. We have to do quicker. Sorry. I keep saying sorry, and I'm not stopping,
But
see?
we continue.
We are really rude people. That's what the surgeons are, right? Push it, that you get material out, right? Perfect. Sorry. I know. Little bit nose. Nose has to be young too, right? We can't make it. We don't discriminate, right? We hurt you equally everywhere. Sorry. Okay. It's fine. Let it leak. And then I go, and we always forget these lines before her ears. Sorry. This procedure will be more comfortable if this lovely lady is sleeping. You should come very close here. Yep. To use this opportunity, because we don't have opportunity around eyes with many things, right?
Yes.
Sorry. These lines, wherever she has these lines, right? We use this. Just relax. We're done.
As much as you can.
I know. You say, okay,
Maybe
you
it's
lay
hard to
down and
say.
you relax, right? I know. Okay.
Nose
Okay,
is a little
good.
bit-
That's okay. We're going to open it now. Push it. If you don't push it enough, it's going to stay on the surface. And then what I do this.
I know.
We just relax. We're done. Okay. I need the cold compresses of saline, please. And we're gonna let this lovely lady. We're gonna turn lights off. Let me just get in your mouth a little bit, and I'm sorry about this. I usually do this afterwards. Make sure that she doesn't have a bubbles. If she has a bubble, she's gonna be biting on them. No bubbles, right? Okay, saline. I need a little bit more fat, please. No, micro fat, this fat. Look. You okay? Good. I know. She's saying I'm okay, just finishes, right? I've been long enough tortured. Okay. Why do I do this? This is really loaded with the stem cells, and we have all these surfaces pretty much wounded, and this is going to calm her down as well. You can close your eyes. We're just going to put some.
And try to enjoy the
Just
treatment.
try to forget about us, right? She said, oh my God, right? I hope it wasn't that bad. Was it bad? Horrible? Okay, would you do it again? I hope yes. I'm suggesting to say yes.
Yes.
Okay, I need just the cold compresses now, and we're gonna, in a few minutes, you'll see actually this redness is gonna be much less. Patient's gonna have some bruising, but patient may be able to cover it all with some makeup and be ready to work in a few days. The procedure, it's much more comfortable if patient is sleeping. It's much more comfortable for surgeon, I think, but for patient for sure. Okay, and I'm gonna do this. You feel okay now?
Yes.
We give you a few minutes, and we're gonna sit you up. Thank you so much for being patient. Best patient ever, guys, okay? Thank you. Good. It's all finished. In a summary, let us see how much of fat we placed. It was 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is 52, 55. just about like 60 cc's to all these areas. I don't think she needs it more. She doesn't want to be overcorrected. To overcorrect will be scary because we don't know if more fat gets alive afterwards. You don't want to have something that you didn't plan for patient to have. Thank you, everybody, for watching. If anybody has a question, please ask. Thank you. Good. Jeste li dobro, gospođo?
Yes.